Imagine hoping for a clear answer to a complex question, especially when it concerns your health. When symptoms like tremor or stiffness appear, understanding their cause becomes a top priority, and you might wonder if there's one definitive test to provide that clarity. A levodopa response test cannot definitively confirm Parkinson's disease on its own, but it is a very valuable tool that strongly supports a diagnosis when combined with a thorough clinical evaluation. The reason this test is so helpful goes right to the heart of what Parkinson's disease is. Parkinson's is primarily caused by a loss of brain cells that produce dopamine, a chemical messenger vital for smooth movement. Levodopa is a medication that converts into dopamine in the brain. So, if someone experiences a significant improvement in their motor symptoms after taking levodopa, it suggests their brain was indeed lacking dopamine, which is characteristic of Parkinson's. This positive response acts as a kind of biological marker, indicating the brain's ability to utilize the increased dopamine. Doctors use the levodopa response test as part of a broader diagnostic process. They will carefully administer levodopa, often over a period of time, and then observe and assess changes in your motor symptoms. This isn't a simple pass or fail. The degree of improvement helps the doctor understand the likelihood of Parkinson's versus other conditions that might present with similar symptoms. For instance, some forms of atypical Parkinsonism, which can mimic Parkinson's, might show little to no response to levodopa, making the test a crucial differentiator. One interesting aspect is that doctors sometimes conduct what's known as a therapeutic trial of levodopa. This means they prescribe the medication to see if it improves symptoms over several weeks or months. A strong, sustained positive change can be incredibly indicative. It helps differentiate classic Parkinson's from conditions like essential tremor, which doesn't respond to dopamine-enhancing drugs, or drug-induced Parkinsonism, which might resolve once the offending medication is stopped. Ultimately, the levodopa response test serves as a powerful piece of the diagnostic puzzle, offering strong evidence for Parkinson's disease when symptoms respond well. However, it always needs to be considered alongside a comprehensive neurological examination, your detailed medical history, and sometimes other imaging tests to paint a complete and accurate picture for diagnosis and treatment planning.